Hey y'all, it's Gabe the Nutritionist here. And again, right, it's part of the series about mental health awareness. We talked about heavy metals, we talked about people that are, having problems that are unknown, right? You go to the doctor, send you to a psychiatrist, go to the experts, you talk to mental health counselors and therapists, and you're still not feeling better, right? And I often tell people, look at your diet, look at your lifestyle, look at your wellness, because a lot of people tend to neglect that. And if you're watching this, you probably more than likely have already taken steps, right, in health and wellness, but it just hasn't been the catalyst you're hoping for that would impact you for certain. So for today's video, we're gonna go over Lyme disease. Lyme's interesting. People often associate Lyme with that little, that bullseye, right? The little rash right there. The problem is only 40% of people that have Lyme disease, they've only recalled that. So there's at least somewhere between 60% of people that could have Lyme disease, but they never saw the bullseye. Could have been in your head, could have been, in your beard, could have been somewhere else in the body. You just completely neglected to see. And, you know, the thing about Lyme is that little tick right there. It has to be on you for quite a while before you're transmitted with some kind of bacteria. And that bacteria you usually get from the ticks, right? It's called Borrelia Burgdorferi, and this is what gives people Lyme disease. So it's been quite a while now. So there's over 50 strains of Borrelia worldwide. There's different ones in different states here. It got its name from Lyme, Connecticut, where people got sick and started noticing these symptoms. Some people may carry a low-grade infection, and some people may have an intense, hardcore, high-grade infection. That's usually when people go get help, they go get treated, go to a doctor, to give them doxycycline and different kind of antibiotics, and hopefully, that takes care of the job and kills Lyme. But for some people, for whatever reason, right, they still have Lyme. So the reason I'm bringing up Lyme disease, right, especially in regards to mental health awareness, because I don't think it should stop. We should keep talking about mental health throughout the whole year because a lot of people are affected. And this could be, a problem some people may have, right? This is why I bring it up, right? Because no one ever talks about Lyme disease. So there's major depression and anhedonia. Anhedonia is like when you feel nothing. It's like apathy. You lose feeling. You're like that feeling of feeling. Whether you're happy, whether you're sad, you should be angry or sad, you don't feel anything, right? Kind of like a zombie. Some people may have sudden anxiety or panic attacks. They come out of nowhere. Usually, this is people that, they never had panic attacks, right? Like this is unusual for them. They never get this. And for some people that usually have it, well, they get it even more. Emotional lability. I think I misspelled that. So with this means people who have mood swings, right? You just get angry for no reason, or you start crying out of frustration for no reason. I'm not too sure why this happens. It could be inflammation in the brain affecting certain parts of the brain, which is why people are having these mood swings. I would relate this to a different part of the body, but I don't think that would be the issue here. Some people could have short-term memory loss, derealization, depersonalization. This is a weird one. This is where you feel like you're not part of the world. Things feel out of focus, things feel blurry, things don't feel real, right? It's a really weird one to have, right? Then people have sleep disruption. Some people get nightmares. Some people may get bipolar-like symptoms, or they just, kind of similar, right, to they crying out of nowhere or anger out of nowhere, right? You change. Some people get psychosis. Some people get suicidal thoughts, motion sickness, where even moving in a car, they feel kind of off. Even walking, sometimes they might feel pretty off. Assuming it messes with your limbic system and you don't feel that you're in control of your own motion. And for some people, they have sensory overload, in which everything is just too much for them, whether it's sound, whether it's sunlight, whether it's just a lot of people around them. It really overloads the senses, and they don't feel fine. Up to 1 to 3 people with Lyme disease have depression. This is why I bring it up, right? And what I find interesting is from this study, they find that people with Lyme are 2 to 5 more times to commit suicide than a regular population, right? So it's not good, right? There's something about Lyme disease, for whatever reason it is, right? It's causing people to commit more suicide or attempt suicide. That's not a good thing, right? So if you do have Lyme disease, I recommend people go get checked, go do testing, find a person, right? A functional medicine doctor that specializes in this because, this is a really serious problem. Go get tested. If you don't have heavy metals, you don't have any other problems, this could be Lyme, just as a precaution, right? So what happens, right? So you have Borrelia burgdorferi. It's a spirochete. It's a kind of bacteria. It invades the nervous system into your brain, right? And this is what causes the inflammation. When it causes an inflammation, you have something called microglia. These are the immune cells of the brain. And when they turn on, it means they're fighting an infection, right? Specifically a bacterial infection. And what may happen is you may have antibodies form against your own tissue in the brain, right? And that could be causing damage. The way I describe, right, having a bacterial infection is it's kind of like a war zone, right, with your body. Bombs are going off, cells are killing other cells, and, within the process, kind of like bombs that blow up, right? I mean, there's always going to be damage to the environment and buildings surrounding, and that's kind of what happens to your body, right? When there's this inflammation of bacteria, you got to fight. It also disrupts your hypothalamus pituitary axis, which is the brain's response from your brain to your exocrine system, which helps you control your stress, right? Your hormone, the cortisol. So for some people, they could have more cortisol, and the body doesn't have the loop right to turn it off. So some people may feel they're in very high stress all the time. It's kind of like fight or flight. They're just kind of stuck in fight or flight, and they can't relax. For some people, of course, it could be severe and to the point where people have a mitochondrial dysfunction, right? Because again, right, talking about that war zone, the immune system, you're fighting this thing, you're going to have some oxidation going on within that fighting to get rid of this bacteria. They have co-infections. Co-infections are kind of disappointing, right? You have this tick. Tick can carry all sorts of things. We don't really know what it carries, right? Which is why you got to get tested, right? But you could be carrying not just the Borrelia that causes Lyme disease, but it could also be the Bartonella, could be the Babesia, could be Ehrlichia. It really depends on what you get, right? And that means you may get more symptoms that happen in different ways, and we'll talk about that soon. So how does it hit your mood? How does it hit your mind, right? So it damages your neurons, which may cause brain fog. You may have lapses in your memory. You have trouble remembering things, like a common one is when you want to find a word, right? You don't want to use it, or you walk into a room and you forget why you walked in, right? This is like your short-term memory. So the thing is, like, this would have to happen, like, pretty common, right? I mean, sometimes we have memory lapses and brain fog and, trouble finding words, right? But this is happening, like, pretty common, like, more than usual, then that can indicate a problem. So then you have the triggering, right? So you have pro-inflammatory cytokines, interleukin-6, tumor necrosis factor alpha. And what happens, right, is it lowers serotonin and dopamine. Because again, right, you're having this fight in your brain, it's affecting the way your brain functions. So you could have a low kind of mood, where you're not super happy, you're not super chill, you're just kind of, a little zombified. The apathy. You don't really feel anything, right? A way to describe apathy, the right, is you could probably shoot someone in the brain and just not feel anything, right? It's not a good feeling, right? Apathy. You kind of feel emotionless. That's the way I would describe it. Then you have autoantibodies, which may trigger, and you might get anxiety, OCD-like bouts of symptoms, right? Where just out of nowhere, right? You want things color coded, you want things perfect, you want things like usually you're relaxed with certain things, right? But if you feel the need to tightly control certain things, then that could be a possible indication. Then you have mood swings, of course, as we talked about earlier. This could be, being angry, being sad, it just comes out of nowhere, right? Like you're not even like thinking about it, you're not even like preempting it, it just comes out of nowhere. Again, right, you have disruption of your hypothalamus pituitary axis, which controls the pituitary gland, and you could feel tired, right? And when you feel tired, it's a weird kind of tired, right? Like you can't just like go and fall asleep, right? Kind of tired. You still feel pretty awake, you still feel wired. They call it wired but tired. And you can't really sleep, insomnia. Because what happens is you're still fight or flight mode and you're tired, but You just don't have the energy to sleep. It's a weird one, right? But for some people, vitamin B1 can help. For some people, magnesium could help. It helps calm down. I'm not sure if there's a complete loss of magnesium B1, which is why this causes a problem, besides the brain inflammation. But this is what some people can feel. And because of that, right, then you have crushing fatigue, right? You're just really tired. You're not getting proper sleep. You're not getting proper rest. So you feel even more tired, right? On top of having damage to your mitochondria of already having existing low energy because of what's happening to your brain and the inflammation. You know, you're not having a well-regulated dopamine, well-regulated serotonin. I'll even throw in oxytocin in there. And this is why some people can have low motivation and they don't really feel the need to want to do anything, get out of bed, that kind of thing. Some people have exercise intolerance, where they can't exercise, they can't push it, they're like, what's the point, right? Like why do I want to do this? Like I don't need to do this, right? People usually feel good when they exercise, they like pushing hard, they like, feeling the benefits of exercise. But if you're like, nah, this ain't it, I'm not feeling it, I don't care, then it could be, a part of all this. And then you have, co-infections, right? Which we'll talk about more in a bit, right? But I mean, certain co-infections have indications. So Bartonella, right, gives you that irritability, gives you that rage. So if you have Lyme and you feel angrier than usual and you lash out and that kind of thing, then it could be Bartonella. Babesia, if you're panicking, you have a little more anxiety, and you feel air hungry, right? Where you breathe in, you breathe out, but you still feel like you got nothing out of it. It could be, in my opinion, right? And what I've seen with people that, with their practitioners, I've worked with people, right, is that it could, for some reason, deplete your B1, right, your thiamine. Usually, air hunger is indicative of having a B1 deficiency. And same thing with panic, right? Because, as I say, vitamin B1 is a chill pill, helps you relax, and it could be a deficiency in that amongst all that that's happening. I should have more, I think. So the question is, do I actually have Lyme disease? Now that's a thing, right? You see, and you figure out if you've had a tick bite, right? The bullseye rash is usually a big giveaway. If you've been outdoors, maybe you're hunting, maybe you're walking barefoot, maybe you're skinning a deer, whatever it may be, right? Even having a dog, right? Or a cat or, a pet, right? They could carry Lyme. And, because they have ticks on them and they jump onto you when you don't even realize it, maybe your pet sleep with you or something, and, that could happen, right? Second, you want to get a serology. So there's a test. I forget the acronym of this test, ELISA, Western blot. And then there's the other immunoblot where they look for IgM, IgG. So they're looking to see if your body has been fighting against Lyme disease. Third, if your symptoms dominate, then you get an antibody index or a PCR. And for some people that are like very severe, right, you'll get an MRI to see if there's any atrophy, in the brain. The fourth, right, again, right, as I talked about, it could be mold or chronic inflammatory response syndrome, SIRS, if it's severe. It could be heavy metals, could be autoimmune encephalitis. It could also be hypothyroidism, some B12 deficiency. Some symptoms are there, but again, right, we're having all these, you know, like emotional reactions, right? And it's probably not hypothyroid. It's probably not a B12 deficiency. It could more likely be the other. So again, right, there's different strains of Borrelia, and they come with co-infections. These are the more common ones. So we gotta understand what they are exactly, right? Yeah, Bartonella. This is essentially bacteria hiding in the vacuole of our blood cells in your enterocytes, right? So these are very small, microscopic, they're intracellular kinds of bacteria, right? And then you have Babesia and Lyme, or just Babesia. I like to think of it as a red blood cell parasite, right? Sometimes bacteria can look like that parasitic behavior, so it's something interesting I like to talk about. Also, you could be infected with anaplasmosis, mycoplasma, and I should have a list here. Yeah, there we go. So yep, Babesia is a protozoa. And to talk about, right, air hunger, you get night sweats, anxiety, fatigue, dizziness, headaches. If you have that with Lyme, that could also be a co-infection with Babesia, right? But what about a Bartonella co-infection, right? You could have foot pain, stretch mark-like rashes, irritability, and cognitive issues. Moving on, you have Ehrlichia or anaplasma. You can get fever, chills, low white blood cell counts, muscle aches, liver enzyme. So when you get this one, it'll feel a little more like the flu in a sense, right? With anaplasma. Then you have mycoplasma, chronic fatigue, brain fog, fibromyalgia-like pain, and immune system suppression. You could also have rickettsia. This could be a rash, fever, headache, vascular inflammation. You can also catch chlamydia pneumoniae. So you have trouble breathing, you're gonna have coughing, brain fog, fatigue. Then there's Coachella Burnetti, causes Q fever, chills, fatigue-like symptoms. There was already Q fever. I do not recall them at the time, so I apologize about that. Then you have Toxoplasma gondii, which is interesting, right? Because you get it from your pets. They lick you. You get it from poop, I believe. So this is a neuropsychiatric symptom. You could have brain fog, seizures. This can happen mostly in people that are immunosuppressed. And so I don't think this is directly from, getting bitten by a tick, right? But for some people with a bacteria, right, you could have an overgrowth in candida. So it's a different fungal thing, right? You could have gut issues, fatigue. Usually sugar cravings is the big one, right? Low bit of mood swings and to histamine sensitivity. This could happen. Apparently, you can also get viruses from this, right? Like Epstein-Barr virus, uh, herpes V6 complex. So you'll get chronic fatigue. And when you're very stressed, that's when viruses activate, right? People often think of viruses as something you get, right? But apparently, in the body, we all have the viruses, right? And when something happens, there's a trigger and it turns on the virus. Viruses are interesting. There's a lot of talk and debate about what they are, and viruses are weird, right? But apparently, this affects you. And these are some symptoms of knowing this affects you. So Lyme, right? It's not just like joint disease. People often talk about the joint pain, right? But again, right, you have co-infections. Unluckily, right, if you get a co-infection. But again, reaches the brain, mimics or triggers depression, anxiety, and or some degree of cognitive decline, right? So as I say, right, you want to have effective care paired with targeted antimicrobial therapy, right? And the reason I say you want something antimicrobial is because again, right, this is bacteria. If you kill it where it lives, wonderful. But there are some problems with that later on, and we'll talk about them. But again, you need mitochondrial support because again, this damages your mitochondria, which makes energy for your body, right? And again, psychological care, right? So if you have, these symptoms, right, you want to talk to your therapist and, understand the thing as a whole, right? It's smart to talk to your problems and you want to get testing with a functional medicine doctor or someone who knows what they're doing, right? Because there's different testing with you know, Lyme and co-infections, and you want to get the right ones. I'm not the biggest expert on Lyme, but I know enough to tell people to, find a good doctor. Here's some information. I hope this helps you. You know, this is informative, right? It's to bring awareness to the issue that people don't know that this is a possible reason for why they're feeling the way they're feeling. And again, right, you can't start this bacteria, and let me tell you why. This is what I find interesting about Borrelia. So it lives on glucose, right? Like other bacteria and other things. Lives on glycerol. Interesting. It also lives on different amino acids like N-acetylglucosamine, proline, arginine, serine, and glutamine. It lives on fats, which is interesting. Also lives on DNA like purines and pyrimidines, which is very interesting. That's what I find even more interesting, right? Like this is weird. Usually bacteria like to feast on iron, right? And our body has, your immune system activate and you put iron into your ferritin, right? Like storage form, you put it into your metallothionein when you have zinc and you store it, right? Because you don't want to give bacteria, the energy to live, right? What I find really interesting is for some reason this one takes manganese. I don't get this. I don't know if this is like unique, but I just thought it was kind of weird that this thing lives on manganese instead of iron. Just really weird. So I say, right, this fucker can thrive on fats, sugars, amino acids, right? So you can't starve it because the only way to starve it is to like fast, but you don't want to fast because it's still, it's eating at you, right? So for that reason, Lyme is kind of difficult to deal with. And this is something I find interesting, right? Is the fact that I found some papers written on this, right, about how doctors say how we can eradicate bacteria. Only problem is within the body, for whatever various reasons, there's something called biofilms. And biofilms are this little shelter. Again, they're made out of different sugars, different fats, calcium, metals, And bacteria and apparently parasites can live in there too, right? Which is really weird. It's like a, I don't know, I guess it's kind of like John Wick where they have the Continental. They live in that, hotel and they're protected and you can't really do much about it. But we'll try and do something about it, right? Get rid of it. So the thing is, the bacteria, if it survives the antibiotic treatment, right, the Borrelia, the co-infections, and you get sick again, you more than likely probably have a biofilm that's where they're thriving, that's where they're living, because they don't want to die, right? There's always that small 1%, right? People think it's often statistical, but it's not usually statistical, right? That 1% that survives. It is that little bit that gets stronger, they eventually grow and they have more generations because plasma, it replicates faster than, other things, right? Like humans, right? It takes us a while. They do it generations and, months, right? So what happens is eventually over time, they build immunity, they get stronger, they get smarter. And it's more likely because they have biofilms, in our body, and they live in there, and they come back if they're not taken out. So this happens, 2 to 6 weeks after antibiotic treatment. You still don't feel better. Symptoms come back. It could be the reason why. So some people that are smarter than me, they came up with the idea, right, that you want to break biofilms, right? And the way biofilms work is to break them, right, is you got to use enzymes, and there's these enzymes like lumbrokinase, serrapeptase, nattokinase, and some of these, right, they break down structure in different ways, right? Uh, I believe it's smart to add vitamin K2, right? Because they do use calcium. So you want to break away the calcium. You want to break away, any proteins they're using, any amino acids they're using, any lipids, fats they're using, any glucose they're using. So the serrapeptase, lumbrokinase, and nattokinase, and even there's other enzymes out there. I'm sure people have formulations for them, right? But they break these biofilms apart. And when you do that, you can finally hit them with antibiotics or herbal antibiotics, whatever your doctor puts you on. And eventually, over time, right, you will get rid of your biofilms and then kill whatever remaining bacteria remains. So as you're doing this, right, you want to mop off endotoxins, right, like lipopolysaccharides. Again, you have die off from killing these bacterias. So using like a fiber, like activated black charcoal powder, it's a really good one for many things. I often tell people, right, for that same reason, right, do more magnesium because you have a lot of enzymes in your body that require it. No D3 pills, less calcium, because again, right, you don't want to cause any hypercalcification. You want to make sure that you got vitamin K2 working so it's going into your bones instead of soft tissue and forming in places where there's biofilms. So this is one of the routes they do, right, to get rid of Borrelia. I'm not a medical doctor. This is the best I did. I'm not sure this is the thing they do, right? The proper protocol. But it calls for doxycycline if it's early and amoxicillin. It could be contraindicated for whatever reason, right? Because again, right, so whoever is a good allopathic medicine doctor on top of this, it would know which would be the better, stronger, more potent forms of antibiotics to use to kill, of course, this bacteria, right? Because some bacteria, as they live and they grow and they thrive and they live for generations upon generations, again, right, they get smarter, they get stronger, and some build immunity. So when you do find a doctor, they should know more or less which is more potent for killing Borrelia and the co-infections. They could use combination therapies and different protocols to make sure they could kill it, right? Like doxy, rifampin, hydroxychloroquine. Again, right? Some of these have properties of antibiotics. And this is going to be on the more natural approach by Dr. Buhner. And these are some other herbs we'll use, right? Cryptolis, Japanese knotweed, Cistus incanus, cat's claw is apparently a really good one, sarsaparilla, and andrographis. But the Buhner protocol is he's the original doctor who was working on this and finding a natural way to take care of Lyme because I'm assuming he was having problems, with antibiotics and maybe they didn't have a good quality antibiotic that would, take care of the job and kill these Lyme disease, Borrelia, and other co-infections. So he liked Japanese knotweed for the resveratrol, and not just that, but it's anti-spirochetal, which is the kind of bacteria it is, and anti-inflammatory. Cat's claw, he liked it for the immune modulation portion, so it helps balance your immune system. And andrographis, he liked it because it crosses the blood-brain barrier, right? And we're talking about your cells being affected, right? Especially with Bartonella. We're talking about Babesia. Like these are in the cells, right? It's not just like outside the cells. So you need something that crosses the blood-brain barrier because it's in all your cells. And here's some other add-ons other practitioners use, right? Like the Cryptolepis sanguinolenta. Uh, Black walnut hull is a pretty potent one. I believe Cellcore likes to use it a lot in the products. Some people say there's good things about Chinese skullcap, and specifically when it comes to the biofilms, right? People say the cystis and Canis T is one of the better ones. Again, I'm not a big expert or a person that specializes mainly in Lyme. It's just information to help you out. Again, right? If you want help with Lyme, go find a good practitioner that does this. I was looking at a video from a man by the name of Evan Brand, good guy. And what I find interesting is he was talking about how apparently in some cows, right, that are infected with Lyme disease, right, that Borrelia can get passed down into raw milk if you drink it. So I found that to be really interesting, right? Like this is something no one ever talked about, right? Or there's a different angle for another possibility of how someone may have gotten Lyme disease, right? So when you do herbs and you do all these antibiotics, right? I'm sure your doctor or practitioner will tell you, right, to cycle because these things are very toxic. They could really damage the fucking your liver and your kidneys. So it's something I'd be careful because it can be dangerous and it could cause more damage. It could cause more bad things than good because again, right? If you shut down your liver, shut down your kidneys, you're shutting down your detox and your immune system suffers at the same time. So again, right, be careful, right? Find a good functional medicine doctor or find someone like Evan Brand or people that specialize in that kind of stuff, right? Because they know what they're doing. They're experts. They've done it for a while. They know what to do, right? Me, I focus on other things. I like heavy metals. I like vitamin toxicity. I like, anything else, right? Because those are my callings. So for cell core biosciences, people love them. They're pretty amazing, right? They have the para one, two, three, four. I believe para one is the one that helps you as a binder. It's very sticky. It gets stuff out of your intestines, right? But it might have been para three or four people use, right? Might have been like tansy or something that is like a paralytic effect to certain bacteria and parasites, which is pretty interesting, right? And then the para one pulls it out. But at the same time, you have the one for Bartonella, Borrelia, Babesia, these different ones, these different textures with the herbs, right? In which it helps you kill these bacterias and protozoas. Then you have biotoxin bounder, which is going to help you as sort of fiber. It binds to the mold, ammonia, Lyme toxins. It's safe. It crosses the blood-brain barrier. For people, they like this a lot. For some people, they're cool and fine with activated black charcoal powder. Again, depends on you. That's have the scale support for your kidney and liver to detox pathways. I'm not too big on this. I think right. I'm a very bare bones building blocks kind of man. I'm a believer in the zinc, selenium, taking your folate, helping your liver work, helping your liver do the job right. I'm not a big using an herb to have a drug-like effect on your kidneys and liver for detoxing, right? For using herbs, again, right, you want to make sure it has a specific job as antibiotic to kill these certain things that's affecting you, right? Then you have these other things for minerals, support, and mitochondria, energy repair. Some people really like these. Lymphactive, I'm not sure about this one, helping a lot of people. Again, right, if you have problems with your lymphatic drainage, again, right, you need to move around more. You got to exercise more. You got to drink more water, get massages, jump up and down, trampoline, right? Because again, right, your lymph system, it activates with movement, right? It's not like a heart where it pumps in a vortexes the blood throughout your body, right? When it comes to, unfortunately, your lymph system, right? You got to move manually. You got to go walking. You got to exercise. You got to do movement to get that to propel. If not, you won't really do much with it. Then you have carboxy, which is basically a more powdery version of biotoxin binder. This is also VRAG Cam. I don't know why I put that there, but apparently it's a great product and they use it for Fukushima and it helped people get rid of radiation. I just think Silicor is a really neat company for people that have these kind of problems, right? So I'm putting it out there because again, right, this information may help someone that has, some kind of problem, right? So again, here's a link to full script. Unfortunately, there's no Cellcore products on there. You got to have a practitioner with Cellcore access to get those products. And again, right, I mean, I like to help people, it's a 30%, discount of all supplements, only get like 5%. I don't really care, right? If you have a better deal, you'll be able to afford stuff and you can help your body and, do what you got to do, right? If you need it. Again, if you appreciate my information, it helped you gain perspective on why your mental health might be suffering, on why the possibility of your depression might not be mold, it might not be heavy metals, but it could be Lyme and co-infections like Bartonella, Babesia, and all the other co-infections you saw on that list. That could be a reason why you may have depression or anxiety, right? You know, you get assessed and they put you on medications, for mental health, and you don't really feel an improvement, you don't feel better, right? It varies from person to person. And some people are very, natural, right? People want to take a natural approach, right? They so choose to do so, and I respect, right, as many people do respect. And yeah, I want people to share this, I want people to like this, because again, right, we're doing this in the name of mental health, right? It's still mental health awareness, but again, right, extend that to all people, right? Because you never know what's really affecting you when it comes to, having poor mental health, right? It's just more food for thought, and when you have this knowledge, you can do something about it. So I have my other videos, which I'll do later on, right, about SSRIs and drugs and weed and how, drugs actually, they ruin you and they're not good for you, right? So a lot of potheads are going to hate me, but I don't care. It's again, right, you got to tell people that some things are bad for you and you can't do them for the benefit of your health. All right, y'all. Thank you. I love y'all. God bless. This wasn't the most informative video, but it's spreading awareness and it's helping you again, right? So if you have this, find a functional medicine doctor, find someone who's knowledgeable that is an expert in this, right? If you have Lyme, don't go to me for help. I do other things like heavy metals and mold and vitamin toxicity and other detoxes. I don't do Lyme because I'm not comfortable with that, and I would need special training to get better at this. All right. So thank y'all. Have a great day. God bless y'all. Leave a comment, and I'll answer you. All right. Thank you, and goodbye.